Thanks very much. I'm not going to dance though. Okay, so thank you so much for inviting me to present today on community action. So I'll talk about what it is and how it can be done. Speaking of community action, I'd just like to show my respect to the continuing connection to community of the Aboriginal people. And just to acknowledge that I'm presenting to you on the lands of the Whadjuk people, but this work that I'm presenting on was conducted on the lands of the Gundungurra people. Okay, so today I've got a few questions that we're going to hopefully get some answers to. I'm going to invite you to think of your own answers to these questions, and we can take them one at a time. So we'll start with, is community action important? This is an easy one to start with. It's a yes-no question. So think of your answer. If you answered yes, you are correct. So we have known for a long time about the importance of community. Obviously, any drug and alcohol use occurs in the context of a community. And actually, just to take some words from the fantastic book of Nicole and Peter that was presented yesterday, you need to consider, for example, the context where you might have collective hopelessness, and that you can prevent the use of one individual in that community, but in that context, another one will just take their place. So you need to have that level of approach. And it's just reflected, here's the evidence, in the correct answer was yes, that community action is a priority area in global strategies. So this is the Global Alcohol Action Plan. Community action is a priority area there. It's shared in our own national drug strategy. Community engagement, a priority there. But what these documents don't do is explain what they're talking about. So what is community action? What is community engagement? It's important, yes. But next question, what is it? So I'll ask you to define that to yourselves as well. What I'm going to do is share to you how community is defined in the literature. So I'm a researcher from the National Drug and Alcohol Research Centre. So my knowledge comes from the literature. And so this might not be a shared definition, but this is just how it appears in evaluation studies of community action. In those studies, it often isn't well explained. And so there are definitions of community that is a shared place or that has shared characteristics. And I just want to share with you that this definition is not helpful. You can see here in this picture, you can see the kids there in a community. They're the classmates. There's the community of the yellow shirt wearers, and there's the community of the entire world. So this isn't a helpful definition. What's action? You can look that one up as well, if you like. You'll find that it is purposeful. It's to act purposefully. Not helpful. Put them together, you have something that a community might do to act upon drug and alcohol use. This is not a helpful definition. So those are the Google definitions. As I said, I'm going to present to you what I've learned from a few years of research, looking at how it's defined, and that's involved looking over 91 reviews on community action. I've done a couple of overviews of reviews, umbrella reviews, looked at over 150 evaluation trials of community action. This is in global, and spoken with a lot of community stakeholders that are doing community action. So we'll come back to the question on the definition there. So this is the best attempt at meeting definition in terms of how it appears in the literature. And that is, the community is generally a postcode. So it's place-based and it's quite small. Community action generally occurs on that kind of scope, or a collection of postcodes like in a local government district. But it is further refined by these groups. So the target might be a place, but it will be only the adults in that place, only the youth in that place, or at-risk people in that place. Typically, it's youth in prevention, and that's typically, again, 12 to 18 years. So the vast majority of the literature on community action has a focus on the prevention in youth in that age group. And the action, I'll describe generally first. So it's generally comprehensive, so it's approaching multiple risk and protective factors, and it's hopefully going to be delivered across multiple settings in a community for that reach. And that it's theory-driven. There's a couple of common theories that a lot of the action builds upon. So community empowerment is just the idea of building capacity to have a response, and when you have that capacity, it's likely that your response will be better. And the diffusion of innovation is just recognising the importance of community and their support and shared values and norms around the action that you want to instigate. And you need a certain level of support for it to take hold within a community, and there's been a bit of research that's sort of put that at a level which is around 10 to 15% of a community that would be in support for something to take hold. And as I mentioned, it's place-based, and within that place, it's organised by the community in coalitions, and it's coordinated in that way. So because that's the case, I'm going to spend a little bit of time talking about coalitions specifically. So what does it look like? The coalitions are coordinated collaborations between formal and informal organisations. That's a broad definition. It can involve anyone that's in an organisation, but you might be wondering which organisations should be involved in community action. And I have here the top four. If you've got these guys on board, then you're doing well. I've got health circled there because that's where community action generally takes place. It only would involve people in health promotion. Ideally, that you would also involve schools, police, and vendors, and that you would be bringing all of these members together in a coalition. And there are other members that are important that are typically overlooked. And again, this is drawing from research in community action, so this is what tends to get evaluated and published upon. And in that sense, it often doesn't involve volunteers, so your mums and dads doing community action, or these other bodies. So researchers, myself, I'm not often involved in community action, although I wish I would be, and I'm inviting myself to be involved in any community action that you might be taking upon. I'll explain why that's important later. And typically it doesn't involve primary government bodies or local government bodies, workplaces, or the industry, funnily enough. And so just a point about coalitions here is that, and we touched upon this yesterday in the panel, that it is a very difficult thing to bring coalitions together. And that's because mainly of the resources involved, obviously, but also the problem of time. So community action doesn't have an immediate impact, and bringing together coalitions can take years. And when you're on funding cycles that are a year, that can be quite difficult. And it's also quite difficult to demonstrate your impact. And also community matters, specifically for drug and alcohol coalitions, more so than other types of coalitions. And that's because the community doesn't always agree with reducing or preventing drug and alcohol use. I mean, I've got a fine example of a place I used to work called the National Cannabis Prevention Information Centre, which was unfortunately defunded, largely because of changes in community norms and values around cannabis, and the idea of medicinal cannabis use came along, and suddenly the funding went away. So community matters, particularly in drug and alcohol. Okay, so what makes a coalition effective? So this is, I'm going to be assuming you have your coalition together, you have the resources, you've got that breadth of engagement that I mentioned, you've got your vendors, the school, you've got the police, you've got your health promotion teams, and so you also have, therefore, a good connection with the community. Then what matters the most? When you have all that together, what makes the coalition effective? It's the leadership. The lead partner in that coalition. And that leader needs to be very good at planning. and I'll go into the planning a little bit further. But also important, these are variables that have come out as being statistically significantly associated with impact. So someone who's good at fostering group cohesion, having a clear communication of a plan, bringing everyone onto the same page, and that same page is agreed upon. And most importantly here is that the lead partner should have the actual power to take action so that they don't have to then go and ask their supervisor if it would be okay if they had the resources to do the thing. So that's a lot about coalitions, and next I'm going to talk about the things that coalitions do. So community drug and alcohol action. And so what I'm going to be briefly summarising is what's in the literature. Again, this is talking about 153 different evaluations of community action and the things that they do. So these are sort of themed headings of what community action is, and I'll go through each of these individually. Mobilisation, information dissemination, involving vendors, advocating for policy, involving law enforcement, and community and health. So community mobilisation, I'm talking about first because this is typically where it ends. It starts and ends with community mobilisation on the streets with community action. And that's the whole idea of just what's involved in forming coalitions, building up the networks of the coalitions, and then engaging with community. And that's typically done by having like alternative activities where you can like hit in a message there when you're doing the thing, or tagging on to community events. They're typically health-focused events where you might have a stall where you can explain what your action is about. So as I mentioned, it starts and ends there a lot of the time without the enormous funding involved with the community action that I've read through in evaluation. And so, whoops, I'm going the wrong way, am I? No. Next, information dissemination. So this is just generally the idea of education involving schools and school programs and school policies and involving workshops and just outreach to community. And if you're very lucky, involving a media campaign. Media campaigns are one of the most effective methods of information dissemination, but also the most resource intensive. And involving vendors, so you're probably familiar with things like liquor accords or just changing local policies within the vendors in the community. And probably most effective in this area would be inviting the responsible service of alcohol training. And then advocating for policy. So the key point there is the word advocating for, because unfortunately changing policy is out of scope of a lot of community action groups because they don't have the policy makers involved. But the policy change we know to be one of the most effective things to do to prevent drug and alcohol use. And you can see the starred ones there are the World Health Organization's best buys. So if you can, it would be fantastic to advocate for policy change on those start things. The problem is that these things are very broadly effective, but they're very inflexible to communities. And there are many communities that wouldn't benefit from these sorts of changes, especially like modifying the price, because you need to be taking into account things like socioeconomic status. And law enforcement. So this is generally just amping up the amount of law enforcement that there is in the community, getting them to do the things that they normally do more. Perhaps the most effective method to invite police to be involved in community action is to enforce things like the responsible service of alcohol and check on vendors that they're doing that. And roadside checkpoints also has a lot of evidence for effectiveness when it's publicised and random. And then just to sort of lump all of the rest of things in community actions involving workplaces, that's typically just education or policy change or providing support and inviting health services. my focus is in prevention, so this isn't talking about treatment centres, but it's inviting health services to, and it's early intervention. So, for example, having screening and brief intervention, or upskilling the ability of service providers to deal with drug and alcohol use. Okay, so that's a broad takeaway of all of the things that community action is. So we've defined community action for you now. So we're going to talk a little bit about how we can make it work. So excuse me, there's some obvious steps in community action. I've got them here in a continuous improvement cycle. So you want to first establish the community priorities, choose an effective response, implement it, evaluate it, and then see what could be done better. So I'm going to take each of these individually, but what you need to do first, and this is also assuming that you have that coalition in place. So you've got the resources to do something. This is how you go about doing it. So the first thing you need is a plan. And there are different ways of planning. We invite people to think of program logic. And this is a form of plan. It works left to right. It identifies the area of need and it links it through mechanisms of change, reasons that your action choice would have an impact, and then looking at the outcomes that would be involved. This is an example. I don't expect you to read it, although you probably could. It's big enough. But it's just an example of a plan that we helped a community in New South Wales, the Forbes community, to do some community action with. And I'll just run through those steps, and they fit into the plan. You'll see a little icon there where you can see the stage we are at in the plan. So first, establishing community priorities. So this is a list of all of the data points that have been used to establish community priorities. These are themed headings. I'm not going to go into each of them. But I do want to just point out that some of them are very resource intensive and some of them are less so. So I've given some ticks there to some points of data collection that may already be happening in the community. If you're able to invite the members into your coalition, for example, police will have access to crimes data. Health services will have access to treatment admissions and clients report. So they're the low resource options. Unfortunately, I would say that they would be less effective in getting the answer than conducting a community consultation, a formal forum or survey where you can ask the questions that you want to ask. This is a high resource intensive way of doing things, and you need to try to be representative also of the community, which can be quite difficult. But we do have tools at our disposal like social media or online surveys. It can be quite easy to get that representativeness. We worked with Norfolk Island, for example, where we just had to have a few posters up in certain areas in the community with a link to the survey. And we got a few hundred people doing the survey, which was representative of the island. And you're able to ask the questions that you want. Okay, so moving along to choosing an effective response. Okay, so I've got here predictors of success and failure. They're kind of two sides of the same coin. And these are elements that have popped up in the literature of being associated with an effective response, with having impact. So the first one is having that plan. Have yourself a program logic. Make sure that there is actually a link between what you want to do and the outcome, and measure the outcome. And so the next point is that you need to be aware of the evidence. Now, this can be quite difficult. You need to be a researcher to do that. You might want to invite a researcher to help you come and talk about the evidence for impact. So it brings me, actually, I'm just going to insert here the question that I had there. Does it work? This is a yes-no question, but it's actually a trick question, because your answer should be a question. Your answer should be, does what work? What are we talking about? I just told you 1,000 things that community action is, so which of those works? And so the answer to that is pretty complicated, but there are ways that can be presented to the layman the non-researcher, I'm not a layman, no, that's rude, to present evidence and the effectiveness. And we're working on a tool here, and that you might have some interest in working with us on. This is what you would call in research design speak an artifact, something that we have as an example of a way of presenting evidence. So you can see that, for example, if you're thinking of doing that community mobilisation tactic of tagging onto an event and having a health promotion attachment. So I'm bringing in here knowledge from the 153 or so evaluation trials that have been conducted. And you see here a pretty quick glance that 54 trials have included this as an element of community action, and that it's going to have a pretty unlikely impact on illicit drug use and even tobacco use, and a probable impact on alcohol. And probable and limited and unlikely mean certain things, and it's based on the proportion of studies that have shown impact and the quality of those studies, and that's shown in the bar graph there. So you're looking for green. So that's just the one element of community action. We've also explored just community action as a whole. If you're taking those whole 153 studies together, you can see here that community action has a very mixed impact, and that was the point of the trick question that I had, because it's as varied as the amounts of things that you could do. But what's important is that across the literature, when you're looking at the outcomes and the discussion of the evaluation trials, even where the intervention didn't work, there's a lot of talk about the successes of just building together that coalition, having the community empowerment and the capacity building that was involved, that was required to take an action. And so there's an element there also of inviting the community and allowing them to have ownership and empowering them to take action. And those things shouldn't be discounted. Even if it didn't work this time, it can work next time, and that's the whole point of the quality improvement cycle that I've been going through. And so just quickly bringing the literature together, the elements that do have the most evidence for impact in community action involve school programs, so long as that you're inviting families and parents to be involved, inviting retail outlets and helping them with their responsible service of alcohol, as I mentioned, so long as it's enforced. And that if you're going to be promoting information, it should focus on where you can get further help, referral to services. And I think I mentioned already the media campaigns have a lot of evidence for effectiveness when attached to a community action program, but they're resource intensive. Okay, moving down, so you want to make sure that what you're doing is within the skill set of the coalition members. That's a bit of a no-brainer there, I guess, but that you should have access to training where it's required and not just forget about it, don't wing it. And do what you can within the resources that you have. Obviously, this is an area that is under-resourced. And just to point out that, unfortunately, the literature and the evidence that we have for community action largely doesn't talk to cost effectiveness. We don't have the data on cost effectiveness. There's a little bit of data on cost effectiveness on community mobilisation, which I'm sad to say is not a cost-effective approach. But it is an area where we need more research, but also you have to do what you can with what you got. And the importance of community readiness, so that you need to be sure that the community is aware of the need. And when I say community, this is like the idea of the diffusion of innovation. You need to have at least a representativeness of the community to be aware of the issue. And this is important, for example, a lot of the times in the literature that I'm aware of, when you're talking about community action, it's someone external to the community that is coming in saying, look, we've got the evidence for this effectiveness, you do this. And the expectation there is that, oh, yes, I will do this. It does have research evidence, but this is just one of the points, and you can see in my list, research evidence isn't everything, of course. And again, it's also very important in the area of drug and alcohol, especially where you have to have the support from the community, and that you can be in areas where there's a lot of opposition to community action, industry opposition. very highly funded, extremely effective opposition. And that you should be aware of a scientific backing, a connection between what you do and what happens. So it's important to have that understanding. So whether it's the community empowerment or the diffusion of innovation that I mentioned, other theories that show good impact is like the social, social influence model, looking at how just providing information is not effective, and that you need to do it within the context of things like having the skills, refusal skills, understanding peer influence, this sort of thing. And then, so understanding of theory. And the last, I guess, is a bit obvious considering we're talking about community action, but you want to have that reach. You want to be able to reach the community, and this can be quite difficult because the types of community action that are common are very targeted. They might call themselves community level, but really it's just a small group that is accessing this thing. Take, for example, the events at, the stalls that might be at an event. That's community action. Everyone in the community has the opportunity to access it, but they wouldn't. So you need to consider reach. Okay, so implementing the activity. There's not much to say about this except that you need to implement it, but you need to have a plan B. And so in community action, and you'll all be aware that things fall apart easily because there's not the resources, because it's focused on, for example, an individual leader who might decide to change their job. You need to have that backup succession plan. Don't expect things to work, is the point. And the importance of evaluation. So evaluation is very difficult in community action, and it's something that most people doing in community action don't really have much awareness of. So you need to ask yourselves, for example, before you even start your community action, did you have a baseline? Do you have some knowledge of what it was that's changing before you do anything? So don't leave things to be too late. You need that pre. But also research design matters. So the evaluation studies often are criticised for their low methodological quality in this area. And there's difficulties there because you want to have things like control groups. But when you're talking about an entire community, having a control community can be quite difficult because you need to match a community in some way, whether it's by population, whether it's by levels of substance use, gender, identity. There's a lot of factors that are involved within a community for you to match to have a control, have a true control. And often the time is that it would just be the next community over, which I'm sure, there's a lot of division between communities over from one another where they would argue that, no, it's entirely different. And you're probably not aware of what makes a good quality evaluation. I don't expect you to have an understanding of like a step wedge randomized controlled trial that has like a time series analysis and, adjusts for covariates. This is not something that everyone knows about, but it is important if you want to have a true understanding of your impact. And that's why I would invite you to speak to me doing community action. But for you, I just want to point out the importance of outcomes in doing evaluation, and that there is a difference in the outcomes that are collected. So there are process outcomes and there are impact outcomes, and I would argue that there's a third level of outcome there, which is just around the capacity building. But here is just a theme again from the literature, that all the outcomes that have been collected to evaluate community action. And so I won't go into each of them again, but I just want to highlight, after speaking yesterday in the panel, the importance of, the importance of the proxy indicators. So we established that getting an indication of use, levels of use on a community level or harm is quite difficult. But what you can do more easily is approximate use by getting perceptions of use, perceptions of harm, and they can be equally important. Or you can look at things like treatment service utilisation. And so just to be aware that the process outcomes are generally what is collected. So in community action, normally you're just collecting that you did a thing, but the funders would be more interested in the other side on the impact, and that's where you need to put most thought if you want to get that funding. So I just want to highlight the importance of proxy indicators there, where you can't get access to other things. And then, as I mentioned, it's a quality improvement cycle, so you want to take that information from the evaluation, from doing the intervention, and just look at how it went, and should you do it again, or should you not do it again? Luckily, you have the the coalition now in place, so if you're lucky. You have that opportunity to learn from what you did, and I would invite everyone to conduct that evaluation and to have that learning and not just continually do things because it has face value. So as I mentioned, I am here to help. I do work in a program that is funded to provide support to community action, and if you would like to gain that from me, you can email me. And that brings me to the end of my talk. Thank you.